But the ligaments haven't solidified yet. Remember, this baby's still growing. And those bones are going to have to extend in length. So you'll find that the bones are all separate from one another, and they are cartilaginous. They look like cartilage. And over time, they ossify. In other words, osteoblasts and osteoclasts grow and break down, grow and break down, grow and break down. Periosteum forms, and eventually the bone gets longer. So by the time this child is 4 or 5 years old, you're starting to get more sort of solid bone. But the bone is still soft, though.
I saw my child when he was small. He slammed the door and
Ow.
his finger was hanging
Ow.
like that. And I thought, oh my goodness, his finger is off. By the time we got to the doctor, that thing was perfectly back to normal again because of that.
It's not joined yet. It's very, very soft. And when a child has a fracture, we call them green stick fractures for a reason. So if you take a stick that's very green and you do this, and it doesn't break. It splits. Children's bones do the same. They split. So all you have to do is set it, and 2-3 weeks, that thing's healed. Very, very quickly. So when the bone starts developing, it forms this area of what we call ossification. Blood supply. This is during embryonic stage. Then the blood supply comes in, and slowly you get secondary cancellous bone starting to come in, and it starts to get its periosteum, and it starts to get all of its joint aspects. Long bones continue to lengthen while the child grows until they are the right height and length that they're supposed to be. And puberty, of course, enhances this entire story. So the moment puberty kicks in and all those hormones kick in, bone starts getting its density, it gets to its maximum length. You need the estrogen, progesterone, and testosterone for that. Boys have a much more dense bone structure and much heavier bone than girls do, simply because they have much more testosterone than women do. Women have testosterone, but very small amounts. Men have estrogen too, but small amounts. They need the testosterone to get bone density because they traditionally have always been the hunter-gatherers of a tribe. They're the ones who run around and do all the hunting. So over time, that's what's happened. This is just enlarging that so you can see how bone solidification takes place. Now, that line, that is your typical ossification where new cells come from. It's called the epiphyseal line. You see that there is this. New osteocytes, new bone cells form there and grow on each side. If you plate this or splint it in any way, you prevent growth. You can have your bones going to get too short. So the bone lengthens from here. It grows both ways. And it continues to extend itself. It's very, very important to keep that free so that it can do what it needs to do. Bone is continually remodeling with the result that a person's total bone mass remains nearly constant. It makes new cells, but it breaks down old ones at the same time. Always. It's one of the only systems in the body that does that. So osteoblasts are bone-forming cells and osteoclasts are bone-destroying cells. Yeah?
In adults, what causes osteoporosis?
Osteoporosis.
Yeah,
It's one of the diseases we're going to be looking at. Osteoporosis is that they call it brittle bone disease. Something goes wrong with the mechanism of the length of the long bone and how the bone develops. And over time, that bone starts to degenerate, and your cancellous bone eventually is all that's left. So your compact bone, which supports the long bone, moves away completely until you end up with, in fact, I've got pictures of osteoporosis. I'll show you what it looks like. There's your epiphyseal plate again. I don't know why I've got this in duplication. Here you can see the baby's skull. See, nothing's joined. It's open. It only solidifies and forms those sutures when it's much, much older. The fontanelles close. You see this one? That's the posterior one and that's the anterior one. They are there to allow the brain to expand and the skull to grow, to give it space until it gets like that. That closes completely around about 9-10 months usually. A little bit longer in some babies. Different types of movement in joints, intervertebral disc cushions. I'm going to go through this quickly because it's kind of repeating what we've already done. It's the synovial joint we discussed earlier. Hyaline cartilage, synovial membrane. This joint does not have that. You only find synovial joints where major movement must take place. This is a synovial joint. This is a synovial joint. It's the only one that can do this, by the way. Your hip, your knee, your ankle. No, your ankle isn't. In between your long bones of your fingers and toes, they are long bones that have hyaline cartilage on the end, and they are synovial joints. Anywhere where you're going to have this kind of bending and movement, you need fluid in there to make it grease in the ball bearings, like I said. Flat bones, compact bones, intervertebral disc, they don't need synovial fluid. They're not doing the same kind of movement. The vertebra have this cushion made out of connective tissue. It's a fibrous pad. It looks like a fat pad, but it's not. It's very hard and very fibrous, and yet it's flexible. So when you're bending forward, it's pinching over here and opening up at the back. When you're bending the other way, it's pinching there and opening the other side. The disc can do that. If the disc moves out of position, as in a slip disc, as they call it, major pain. Huge. Because it pushes on the ligaments that are surrounding it and on the nerves that are in there, and it's painful, very, very painful. So you want those discs nice and healthy and staying in position under the vertebra, because they are cushioning the vertebra. Otherwise, you'd have bone on bone. So if you lose a disc due to injury, damage, car accident, whatever the case, and they fuse those two together, they're going to put a plate with screws in it, and they're going to fuse the two together. In other words, you lose the movement of that joint, gone. So if you've had 3 or 4 fusions, your movement's unlimited. You can't do this kind of thing. You basically move like you're in a brace. That's how it works. These are the bones, the top of the neck supporting the skull. They don't look anything like the other vertebra. They don't look like this at all. Your cushion-like pads in between, each disc has got an outer ring. They've got cartilage on the inside. However, these ones have got discs in between like this, but look at their shape. They don't have wings on the side. Why do your vertebra have a wing on the side? It's got a spine at the back. In other words, it's this shape. Let's draw it. It's got a body, then it's got a piece that looks like that, and then it's got a wing coming off each side. So when you're looking at it from the front, you're seeing the body, the opening where the vertebral canal goes through. It's a bit like that. That is where the vertebral canal goes through, the spinal cord. This is cancellous bone, cancellous. Vertebral disc underneath it. But what makes those of the neck different is they don't have the wings. And they don't have that. They don't need it. Why are the wings there? Remember what I told you about the 12 thoracic vertebrae? What are they for? You've got 7 neck ones, and then you've got 12 thoracic ones. What do those 12 do? Your ribs are attached to them. So your rib forms a joint with this, and then comes together here in the sternum in the front. So the rib makes a joint here. 12 of them all the way down. Your neck doesn't need it because there's no ribs attached to it. Your first one is up here at T1. So C1 to C7 look like that. They're very different. Most of them have they all have an opening because the spinal cord has got to go through. That was the whole point. So this top one has got 2 funny looking little articulation platforms, as we call them, because your skull literally is bobbing. 2 points of your skull, the bottom of your skull bone, and when we do the skull bone, you'll see it's got 2 little points at the bottom, are resting on that, and they're literally just rocking on it. So what's stopping your head from falling off? Ligaments, muscles, and all the other structures that are holding that whole story together. Remember what I told you about bones? It's a pile of bones. If it hasn't got ligaments holding it and you pick it up and you drop it, it's a pile of bones. So your cervical, whichever way you want to pronounce it, are 7 of them. They're a little bit different. The top one looks like that, the second one looks like that, the third one looks like that, and the other 4 look a little bit more like other vertebrae. It just doesn't have the wings because it has no rib attached to it. It doesn't need it. So what is the story here? You have an opening down the middle of all of these things for the spinal cord. But remember, your spinal column and the vertebral column is giving attachment to the spinal cord and then all the nerves. After each and every single vertebra, a nerve comes out through that opening at the side. But I didn't bring my pelvis. I normally bring it with. I forgot to bring it. So one vertebra packs on top of the other one, if you're looking at them from the side. No, I don't know. But if you're looking at it from the side like this, you'll see that there's a little archway. Spinal cord comes down here. Spinal nerve comes out through the opening on both sides. So you've got a spinal nerve coming out of every single vertebra, supplying all the tissues in that area. And on the 12 vertebrae of the thoracic cavity, they run along the ribs. So the nerve leaves the spine and then runs along the edge of the rib. You'll see the top of the rib bones have a groove. Nerve runs in there. And it supplies everything. But I need you to remember one thing. If you remember nothing else from what we're doing today, and we'll finish just now, remember that your vertebra and the nerve supply to the vertebra is only for the muscles, ligaments, tendons, and the tissues, the skin, fat, and everything else on the outside of the body, on the outside of the cavity. On the inside of the vertebra, in other words, where your stomach and digestive organs are and your chest organs are, the nerves do not come from the spine. They don't come off here. Do you have any idea what supplies the digestive system? It's an interesting thing, this. There's a nerve called the vagus nerve. It's cranial nerve number 10. It originates here at the back of the brain in the brainstem. One on each side. It doesn't have much to do here. It travels down from here and it has a little bit of action around the respiratory things here. It goes down through the chest cavity, runs on either side of the major blood vessels behind the heart, goes through an opening in the diaphragm and supplies the entire digestive system organs, or all branches of the vagus nerve. It starts digestion and it ends digestion. So the vagus,
you take this apart.
yeah, the vagus runs down here deep into the body, and all of this is supplied by branches of cranial nerves. Now the interesting thing about that, one would think, seeing as the nerves come off every single vertebra to supply the whole body, why are they not going on the inside and supplying the inside? Have you noticed that a paraplegic or even a hemiplegic can still digest food, can still pass urine? They don't have sphincter control because of the paralysis, but they're still making urine, they're still passing urine, they're still making stools, yeah? They're still digesting food, they're still doing metabolism, everything's still happening. Why? Because it's not a spinal nerve that could have been severed by that car accident or that injury or whatever it is. It comes from the vagus up in the head. It's like a God fail-safe system, if you like. Amazing, isn't it? So everything in this cavity is supplied by the vagus nerve, which comes from the back of the head here, the medulla. The vertebral nerves, all of them, that run off the spine at the back and run along each nerve, supply the outside of this. So skin, fat, connective tissue, muscle, bone, and anything else, but not the organs. Even the pelvic cavity. So that's an interesting thing about this. It's nerve supply. So you understand the difference in the structure of the different vertebrae. Joints, we call these biaxial joints. Look at your foot and look at your hand. Completely different looking. They're long bones though. They're small long bones, but they're still long bones. So they still have hyaline cartilage here, and they still have a synovial joint there. Gout arthritis, favorite place here. The foot. Lots of little bones, all sliding and grinding over one another. Not classical joints as in elbow joint, hip joint, knee joint, not at all. Look at them. Classic synovial joint. Elbow, hip, knee, fingers, toes. One bone, another bone, hyaline cartilage, synovial membrane, ligament on the outside. That's how it is. Grease in the ball bearings, because this joint has got to do a lot of movements. You cannot do this with a joint that looks like that. Not a chance. If you want full range of movement, you've got to have a synovial joint. You need some kind of fluid with a smooth edge so that that joint can roll. And look at this. Look what you can do with it. You can't do that with any other joint. Your hip joint has not as much movement, but it's still got quite a lot of movement. You can do a lot with your hip. Your shoulder joint, another synovial joint. Why is it slightly different? Because of its angle. So it's hanging down. So when you're lifting your arm up, that membrane stretches and goes flat. And when you put it down, It hangs in a loop, but it's all synovial fluid. It is hyaline cartilage, the rotator cuff, ligaments on the outside holding it. That is your ligament bandage. This is some of the structures of the joint. That's what the joint looks like without all of its coverings, but look how much tissue it's got around it. Mountains of ligaments, tendon, muscle, lots and lots. Remember, your arm and your hand is one of the things you use the most. Shoulder joint, very complex. Look at it. Look at this muscle that has slingshot through there. That's what enables you to do this. You wouldn't be able to do it if you didn't have the muscles arranged exactly like that. Lots of arteries, lots of veins, lots of nerves. Nerve infiltration. These are the nerves that come off. Remember I told you that your nerves come off the gap between the vertebrae? So these are the ones in the neck. They don't go out straight because they're not running along ribs. They come and they hang down, and then they come down into the arm here. And they form the brachial plexus, and they supply the entire arm. So your vertebral column supplies an opening for your nerves to come out, and for those nerves to supply everything. So tomorrow what we're going to do is carry on with this. This is just your hip joint, another synovial joint, looks slightly different, but you can always, the moment you see that blue, you know it's hyaline cartilage. You can see there's a membrane and there's synovial fluid. Look at the ligaments covering the hip. Interesting joint, isn't it? The one fits into the other, and there's a little ligament that holds it in. They dislocate quite easily, and so does the shoulder. Anybody ever had a shoulder or leg dislocation? Painful, hey? But you've got to get that back in again. You've got to push it back in, and there's I fell once and dislocated my knee very badly. And I realized what I'd done. I sat down, and I remember before I could even think, I took it and I shoved it back in position again. Then I took myself off to hospital, but by the time I got there, it was okay. They didn't need to do anything. Knee joint, again, another picture of that same knee joint. Look how complex its anatomy is. And functions of joints. Movement, connects two or more bones together, supports stability, absorbs shock. Shall we end there, or are you guys brain dead? Movement of joints, different names for all of it. And then we'll go on to diseases of bones and joints.